When I was first diagnosed, of course I was in shock and never imagining that I would be diagnosed with renal failure when I arrived at Sunnybrook Hospital.
Before Michael got diagnosed with aHUS, was a regular family life. Michael worked a full-time job. We had 2 small children at home, so I stayed home with the children and took care of them. This disease has had a huge impact on our kids as well, just because they have never really seen Michael as a healthy dad.
At the time that I was diagnosed with aHUS, suddenly everything became clear about all the problems that I had had before that time. It had been an 8-year period of misdiagnosis, and at that time I had gone through a transplant. The transplant failed, as we know, and we didn't know and understood at the time why it failed, because it seemed to go well in terms of surgery and everything was ready for the transplant. So with the diagnosis of aHUS, the chances of success of a transplant is very, very small.
We had the transplant and it started failing right away. Michael had many more plasma treatments. In total, he has had over 1,600 units of plasma, and the end result is that he has lost both his kidneys. My kidney was lost regardless of the fact that he had so much plasma, and he now is back on dialysis. So that to us is proof that plasma does not work for his disease.
When I first heard about the drug Solaris, I was extremely excited of the prospect of being able to get my life back, and because without the drug, unfortunately, I was told that I cannot have a kidney transplant.
Knowing that the drug exists and not having access to us is very frustrating. We expected that living in Canada, having universal health care, that drugs that work would be accessible to us. And we're now very disappointed.
Because we have a rare disease should not mean that we are treated differently than people with a more common disease. Because it is an expensive medication should not mean that we should not have access to it. It kind of feels like the government is putting a price on people's lives.
On behalf of all the aHUS patients, I want the government, ask desperately to the government to do the right thing and provide us with Solaris so that I and the rest of the aHUS patients can get back to our life, to our normal life, to our routine, that we can wake up in the morning and feel that we can handle the day ahead without worrying that this disease might kill us.